I'd like to welcome you to WorkWell's first ever Wellness Legacy Awards. I'm Rod Fowler, your host for the night. I am pleased to see all of you here for the event that is sure to inspire you as we celebrate those who are leaders and champions of wellness. This night would not be possible, though, without the support of many, including our sponsors. And we want to send out a really big thank you to the Nebraska Department of Health and Human Services, Assurity Life Insurance Company, and the Community Health Endowment, who have generously provided resources for our program this evening. So a big thank you to them. Also, a big thank you to our WorkWell committee members. Please see the back of your program for a list of those committee members who provide support, guidance, and insight for WorkWell. Also, our Nebraska Safety Council and WorkWell staff you see listed on your program have been very much a key to this first Wellness Legacy Awards event. We also appreciate the Nebraska Safety Council board members in attendance tonight. Please give all of these folks a round of applause for their dedication to the health and well-being of our community and our state. All right, now this evening we would like you to enjoy your meal, of course, with those at your table. Please take some time to eat and visit after our invocation by Lori Klosterbor. Lori?
Thank you, Rod. God of all creation, we come before you this evening in thanksgiving and to celebrate. You are the source of all that is good. You are the source of all of our blessings. We ask you to bless our meal and our time together. Thank you for every gift that we have been given. We thank you for the opportunity to be amongst each other. We ask that you guide and watch over us and help us celebrate. Thank you for helping us to accomplish our work and goals as we endeavor to make life better for others. Amen.
The Nebraska Safety Council and WorkWell strives to be an industry leader in safety and wellness. Providing leadership and direction provides great opportunity at demonstrating successes. That is what tonight is about. Tonight is designed to celebrate individuals who have provided leadership, inspiration, and support to others through their professional work and personal influence. WorkWell is privileged to provide this award event tonight to recognize each of these individuals for their hard work, influence, and perseverance. WorkWell Director Tanya Villadol has been a true leader in our city, our state, and even our nation with worksite wellness, and I'd like to bring her up here to give you WorkWell's official welcome and ever make a few remarks about why leaving a legacy of wellness is key to the success of all we do. Tanya?
First of all, I want to say thank you to everybody for joining us tonight. I hope you're enjoying yourselves. I am really enjoying myself. It's my one opportunity where I really get to spend time talking to people and getting to know you in a different way. But thank you all for coming and celebrating with us tonight. We're very excited. So every day I speak with people who call me who want to get into the field of health promotion or wellness. And it seems like they're always very excited. Oh, I just want to do what you do. Oh, I want to do this. Oh, I want to be in worksite wellness. And although I'm very excited that we have so many new people coming into the field that want to do worksite wellness and want to be part of health and well-being, the one thing that I always have to do is to start with asking them questions. How passionate are you? Are you a person that can persevere? Do you have patience? Patience is going to be key in this field. Do you understand there's going to be a lot of personal sacrifice? Are you able to set aside your own wants and needs for the betterment of other people? Those are a lot of questions that I ask people when they call who want to get into worksite wellness. And what I would love to say to you all today is that many of the award winners, no, actually all of the award winners have those very things in common. They persevere, they're passionate, they have sacrificed a lot to pursue their goals and to be where they're at today. So we're very fortunate that we are in a state such as Nebraska that has built this culture of health and well-being, and that we have so many people like those that we're going to recognize tonight that are highly capable and are so passionate about worksite wellness. So I'm very, very thankful to be here, and we are excited to get the show on the road with our very capable and highly energetic speaker, Andy Hunziker. If you wouldn't mind coming up for a moment, Andy. Andy is the CFO, the Chief Financial Officer of Lincoln Industries. I had the great pleasure of working with him for several years when I was there. And he just is a very remarkable human being. One of the things that I love about Andy, there's lots of things to love about him, by the way, but one of the things that I really love about him is when he first came into Lincoln, I had been there for a while, about 2 to 3 years. He right away did not ask me about the return on investment at Worksite Wellness. He did not he did not ask about the financials. I know for some of you he probably asked that every day, but for me he didn't ask that right away. What he said is, "Okay, I get this. I understand this. Let's put some figures to it." And he just has this breadth of understanding, and he gets the big picture. So we are very, very fortunate to have him here tonight to speak not only from a business perspective, but also from a personal perspective. So please welcome Andy with a little round of applause, and I'll let him have the floor.
What's the CFO doing up here talking about wellness? I mean, look around at the people that are sitting here. You've got doctors, you've got wellness professionals. Why would a CFO come up and talk about this? Well, I have the opportunity to talk a number of times a year about wellness, culture, and I used to go around all over the place talking about it, and I don't do it anymore because I have a normal job. But what I'm talking about today is our community, and I'm happy to come up here and talk about our community and wellness, the impact it has on that, because I'm also happy to talk about our company and my friends that are here from Lincoln Industries, the impact it has on them, and also the impact it has on each person there, and each person around the organization, as well as the people in their home. So I'm happy to be here, happy to talk a lot about this. Lincoln Industries is where I work. Started in 1952. We, family-owned company, grown about 600 people. We've grown, let's see, year 2000, we've grown about seven times in sales and people in that time frame. So we've grown pretty significantly. And we've made the Great Place to Work 7 times in the last 8 years. So for a small to mid-sized company, nationally we're known, so it gives us a lot of opportunities to talk about our company, our culture, and our wellness. So what I came to talk about is our company, the impact it has on the community, the impact it has on our people, and the impact it has beyond. So we're based on our beliefs and drivers. It's a set of values and actions that define our business. Our beliefs and drivers are not who we strive to be, but they represent who we are. If you look at them and you don't fit, you're not going to fit in our company. So it really drives our culture and who we are. Part of the change was 8 years ago, the beliefs and drivers have been around for about 30 years. 8 years ago, we made our first change. And we had wellness and healthy lifestyles are important to our success. And it was important to our success for a number of reasons. But it's who we are. And it has to do with the culture of the company. It's not a goal we strive to be. It truly is who we are. When I talk to a lot of organizations, we talk about the financial impact of wellness. Everybody wants to know, as Tanya was saying earlier, what's the impact of a wellness program? For us personally, our insurance rates are about $5,000 less per person than a company of similar size and similar work nationally. So let's do some quick math here. If we have 500 to 600 people, you're millions of dollars, $2 to $3 million. We are not a low-cost company, so we don't go around and say, you know, we're just going to take that to the bottom line and reduce our costs. We reinvest. What does that reinvestment do? Suddenly we have more equipment in our company. That's how we grow multiples, because we have the capital created by our wellness program. We use that, specifically our wellness program, is a competitive advantage. Our competitive advantage is we can charge what we want and we can reinvest because we have money created by the wellness program we have, the culture we have. And that is a big benefit, not only within our organization, but also outside as people realize more about us. So wellness being part of our company culture, how does that work? Wellness is no different than any other part of our culture in that if leaders don't embrace it, it won't work. And at Lincoln Industries, we're blessed in that we have leaders that do embrace it. Our company, every year, goes on a mountain climb, a 14,000-foot mountain. If you pass the wellness test, which is a biometric screen, as well as the fitness test, the company, it's an all-expense-paid trip to Colorado to go on a mountain climb. Now, you're talking to people that are working on an assembly line. You're talking to people that are leaning against a pipe, against a wheel, that have never been outside the state of Nebraska. These people have no idea what a mountain's like. And so they train, they work, they push themselves to have the ability to go on this mountain climb. Well, it goes back to the leadership. How does that impact us? As a senior leader, what do I have to do? I have to go on that mountain climb with them. So I've gone on 1 to 2 mountain climbs a year, climbing the 14,000-foot mountain every year. And what we do when we do that mountain climb, it's less about scaling and getting to the top of the mountain. It's more about all the people that are working to get to that mountain and the impact it has on them. There is very little makes me happier than the first time somebody that came from a small town in Nebraska works their way up a mountain. And they've told me 10 times they can't do it. They've said, I can't make it farther. I have to turn around. Nope. 5 more steps and we'll keep going. When they get to the mountain climb, they start crying because they never thought they could do it. That is a wonderful experience that they'll never forget. They're taking pictures on top of that mountain and they're sending it to their wife. They're sending it to their kids saying, look what I did. I made it. And hearing their stories at the end of the day are just fascinating to everybody that's there. Tanya brought up the return on investment. About 12 years ago, a strapping young man was a new vice president of people resources, walked in during budget time of year and said, all right, Mark, I know we spend a lot on wellness, but I think it's a good investment. I'm going to figure out what the return on investment is, and I'm going to prove to you that we make the right money coming back on that. And our owner looked at him and said, if you really need to do that, you can go ahead if that's what you need. But I know if people are happier, healthier, they're happier, they're more productive, and in the long run, we'll get more out of it. And that's what our wellness program is based on. It's what our culture is based on. If I look at wellness in our company and how it's changed in the last 10 years, and it's changed pretty drastically. 10 years ago, when I first started here, the big thing we did was we would have quarterly checks where they checked your body weight, your body fat, your flexibility, your blood pressure. And every quarter, you go in and get all those checks. And it wasn't optional, it was mandatory. And it was part of your insurance package. And so you'd go in there and you'd walk out of there, and then you had to go sit down with one of the wellness people. And that was horrible. You'd have somebody like Tanya sitting there looking at what your weight's done in the last 3 months, then 6 months, and then she'd look at that. Didn't even need to say anything. But what it did is held you accountable. And it worked well for a while. We've grown from that and changed from that to where we've got to the point where we do biometric screening. And we do that, and we do that once a year. We still have checks a variety of different times, but the biometric screening is what's done at that. The other thing that's changed significantly in our organization as far as wellness goes is we no longer look at just the physical wellness. We look at the wellness of the entire person. If you aren't going to be physically fit, if you aren't spiritually grounded, if your family life's in shambles, if financially you're struggling, so the ability for you to come up and give programs to really help people with financial peace. Let them get out of debt. Make it so they aren't constantly worried about the next thing, the next bill that comes in. Make them figure out what they have a purpose in life. Understand what that means to them so that they sleep better. Understand their family problems. Give them smoking cessation options. So we've really done a lot of work with there. And it's, like I said, it's focusing on the entire person as opposed to just their caliper rating at any given point in time. The other thing we've done a couple new options with our company as far as we have an on-site clinic. Now, remember, I'm a CFO, so I go straight to the dollars. We have a typical doctor visit takes you 2 hours because you're going to get off work, you're going to drive to the doctor, You're going to go sit in the waiting room for a while. You're going to go talk to them for 10 minutes. And then you're going to go back outside, maybe go to a pharmacy, and then you're off back. So you're out 2 hours. With our on-site clinic, you're there 45 minutes. Of that, you're walking to there. You spend half an hour talking to the doctor or the physician's assistant, of which 10 minutes is actually talking about whatever your issue is, and the other 20 is talking about your life. What's going on? What can we do to help? How's your weight? What else is going on in your world? And what issues are there? Do you need some help? We have people that go with Weight Watchers, and they go every other week to get weighed. Talk about a reality check. You're going to sit in there, and they're talking to you. That's a different way. The other thing we did in 2012, our company was 60 years old, and we talked about building this huge different things we could do as far as have some huge gazebo where we could hold parties out there. We could have a huge patio where we could have picnics or whatever. And we said, really, that isn't really who we are. What we decided to do was put a fitness center up there. So now, how does that impact everybody's life? Well, if you go up there at lunch, you're going to find somewhere between 10 and 20 people up there working out at lunch. Well, guess what? When I go there 3 times a week, do my 3 or 4 miles on the elliptical or the treadmill, I have time at home with my kids in that 1 hour. So I'm not only impacting myself and my wellness, but my time with my children. There's a couple stories I want to tell, and this goes back to the impact we've had on people's lives and the impact and how that rolls through the community, et cetera. There's a lady I know that when I started, despised the wellness program. Thought it was the stupidest, most infringent, got into my personal life. You made me go get on a scale. You made me do this. I can't believe you're making me do this. Because we were pushing her to do that. We made her do it. If you put that same person in the right culture, where now it's a pull, people are around her talking about, hey, you know what, we're going to go to the half marathon. You going to think about doing that? Would that be a fun thing to do? Maybe you can just walk it. Let's go for a walk. Let's go walk 5 miles. Let's see what we can do with that. That same person suddenly started saying, I am going to take a little bit better of care of myself. That same person who was laughing at our whole wellness program suddenly is doing half marathons. That same person who was a clerical person is now a manager. So not only did it improve her personal life, her wellness, it improved her work performance. That same person who said, you know what, I don't like wellness, I don't like the way this is, suddenly is volunteering in the community because, hey, there's a marathon, I'm not going to run it, I'm going to go hand things out. Her life has changed, and it's just the start down the path of something that happens there. It's a wonderful thing, because it's, like I said, it's not only here, it goes right down the path. Another person, he was a 2-pack-a-day smoker. He and his wife both were. Their son at home had asthma. He was on multiple medications for his asthma. So what they do? We tried for years to get him on tobacco cessation. Finally, he and his wife did it. They got on tobacco cessation at the same time they did Weight Watchers. Well, how does that impact it? So he all of a sudden starts feeling better. It starts working. So does his wife. They've lost the weight. They feel good about themselves. They quit smoking. Well, guess what? Their kid isn't on asthma medication anymore. Guess what? Their kid is active all of a sudden. Guess what? All of a sudden, and I'll talk a little bit about the thing that were in the news today about the obesity. All of a sudden, that same kid who was out of breath because he didn't have the breath to go do something, is out doing things, is active, and is in better shape, and is active in the community. One last person I want to talk about. We had a person in Lincoln Industries who really had never been out of the state of Nebraska. His life was in turmoil, went through a rough divorce. He was receiving counseling as far as the divorce he went through. He always wanted to get out of Nebraska and go try something, do the mountain climb. So he trained for years, trying to get to the point where he could go do the mountain climb. So finally, after 3 years, he qualified for the mountain climb. He was ecstatic. The next night, and he's one of those guys that leans against a big tube, against a wheel, polishing parts. He goes home the next night. His 2 daughters and his parents are there with a cake. Congratulations, Dad. Congratulations, son, for achieving your goal. How much did that impact the community? How much do you think he's ever going to forget that in his life? That he changed his life? Do you think his kids who watched their dad go through things to become in shape, or you think that's going to impact them? And how about his parents, the pride they had? It's a wonderful, wonderful story, and it goes back through not only the impact it's going to have on him, but the community and everything else that goes along with it. I read in the paper this morning the childhood obesity rate is down 10%. We have the data that supports the fact that specifically when kids are fit, regardless of their skill, they do better academically across the board, but especially in math, reading, and science, said Michelle Welch, LPS Wellness Coordinator. The improved academic performance ultimately translates into an improved workforce and economic benefits for the community, said Bob Rauner, Director of the Partnership. The people who are in this room would not be here if you didn't believe this. We need to continue to push wellness with WorkWell, with a variety of different organizations within the city, in all stages of our life. We as a group need to give people the opportunity to improve. And it can't be through push, it's got to be through pull. Surround them with a culture of wellness that will drive their individual improvements and leadership that walks the walk. And everybody is a leader, it's not just anybody. Wellness and culture that improves the communities in which we live, the companies we work, and that make each person the person we want to be. So, thank you for your time.
We are very fortunate here in the state of Nebraska that leaders such as Dr. Joseph Acerno are supporters, promoters, and champions of worksite wellness. WorkWell is privileged to have built a partnership with he and his team at the Department of Health and Human Services. Dr. Acerno has served as Chief Medical Officer and Director of the Division of Public Health for the Nebraska's HHS since 2013. Before assuming this position, he served as Deputy Chief Medical Officer for the Division of Public Health from 2007 to 2013 and as legal counsel from 2006 to 2007. He holds a Doctor of Medicine, Juris Doctor, and Bachelor of Science from Creighton University. We are pleased that he is with us this evening, and now I ask him to come up and share with us how worksite wellness is such a great avenue for promoting health and well-being for the citizens of the great state of Nebraska. Doctor?
As the Chief Medical Officer, I could tell you there's really nothing I could add to what was just said. It is the example. It is the attitude we're all looking for. It works. We know it works, and we keep beating the drum. And it's the folks who are really doing it day in and day out. The Department of Health and Human Services, we work hard to carry that message, but we can only take it so far. It really has to be the folks in the industry who believe in it. And there's quite a bit of dedication and commitment by a lot of people to make that happen. And it's interesting being in a group like this because it's kind of like preaching to the choir, everyone knows. And probably after this, we'll all go out for a 4-mile run. But even though it is raining, we're that dedicated. But with the department, it's working with families, employers, students to really get the message out of the importance of it. And when we work together, we do gain the most from all the wellness initiatives. And Nebraska Department of Health and Human Services is proud to be a supporter of wellness programs across the state. The state of Nebraska is a model. It is more than maybe any of you know. It has been inquired about. CDC folks have been here asking, what are we doing in the state of Nebraska? What makes it work? And we tell them, and they're like, wow, it's pretty innovative. So hopefully we can be a model for the rest of the country. I'd like to thank you for the work you've done to help Nebraskans live healthier lives, and congratulations to all the award winners tonight. Thanks.
As you know, we are here tonight to recognize 7 individuals who have left a legacy of good health and wellness, impacting their families, friends, co-workers, and communities with their inspirational, healthy lifestyles and wellness leadership. The examples and contributions of these individuals will have a positive effect on future generations, and I'm so excited to get to recognize these outstanding individuals and tell you their stories. After I have shared each recipient's accomplishments, I will ask them to step up to receive their award from Dr. Cerno, and then I will ask them to turn back towards the audience for a picture with Dr. Cerno, Tanya Villadol, and also Laura Klosterbor. All right, are we all set? Let's kick it off. Our first award category is the Wellness Champion Award. We have 3 individuals who were nominated for this category, 1 for the Individual Champion and 2 for the Leadership Champion Award. And all 3 are being recognized as our overall champions this evening because of their fantastic accomplishments. The Wellness Champion Individual Award recognizes someone who has made significant improvements in their own personal health or has been a living example of a well and healthy lifestyle for several years. Our recipient for this award is Kim Pickerel, who is a registered nurse at Lincoln Surgical Hospital. Kim was nominated for making great strides in her journey to better her health. Kim was shocked and concerned after receiving the results of her blood work in 2014. Her lipid panel was unhealthy, and with a family history of CAD and diabetes, she knew she needed to be fighting for her life. Yeah, it was time for a change. So, Kim made a conscious decision to take control of her health. She started an exercise program and began working on her diet. She lost a significant amount of weight since she started, and her blood pressure decreased. Kim had her blood work retested 4 months after her initial test, and the results were staggering for the better. Her total cholesterol dropped, her HDLs increased, and she had a major reduction in her triglycerides. As impressive as the results have been, Kim is even more amazed by how much better she feels overall. Her physical activity tolerance has risen significantly. She can now easily provide patient care. It involves squatting, lifting, and otherwise assisting patients with ease. And going for a walk is now actually pleasurable for her. Her improved health has boosted her self-confidence, and Kim is dedicated to continuing on the right path to getting healthy. She follows up with her doctor regularly and receives encouragement and guidance from a health coach. Her physical and emotional results clearly show that she is on the right path to improving her overall health. For all of Kim's achievements and examples, I would ask that she step forward right now to receive the Wellness Champion Individual Award. The Wellness Champion Leadership Award recognizes individuals who have made a significant contribution to the advancement and the promotion of personal health or the health of others. We are recognizing 2 individuals this evening with this award. Our first Wellness Champion Leadership Award goes to Larry Dietrich of Lycor Biosciences. Shortly after beginning his own wellness journey a few years ago, at the age of 55, Larry thought he would join his coworkers in the newly created Lycor Running Club. That year, he had completed his first 5K and first half marathon. Not bad. Loving the feeling he got after running in a big race, he was hooked. Fast forward to 2015 now, and he's completed in 7 full marathons, including the Boston Marathon at the age of 62. How about that, right? Larry now leads the Lycor Running Club, in part because of the support the club provided him when he started his running journey. He appreciates the encouragement and advice he receives from the other members, and even after several years as the club's leader, Larry feels that it supports him as much as he supports it. Since 2013, the club has yielded 94 entries in races and logged more than 1,000 miles of racing. Lycor Running Club partially pays for employees' race entry fees for the Lincoln Track Club races. Larry is the go-to person at Lycor for all kinds of running advice. The reason the running club has had so much success and has grown to over 40 members is because of Larry's passion for helping runners at all levels. Many people seek Larry out for running advice and tips, such as proper running form, proper shoe fit, injuries, hydration, and fuel. He understands that the important point is that every fitness journey is an individual endeavor and that everyone must deal with his or her own challenges. Not only does Larry loved running, but he also bikes to work and serves as a LICOR Wellness team member. Larry leads by example and should be recognized for the significant contributions, including his promotion of personal health and the health of others. Larry, please come forward to receive your Wellness Champion Award. Our other Wellness Champion Leadership recipient is Jane Hansmeyer of Norris School District and Educational Service Unit Number 6. Jane has been instrumental in empowering hundreds of professional educators and thousands of Nebraska students with a better grasp of how to plan for and attain meaningful wellness goals to achieve healthy and productive lifestyles. She spent the last year as the project director for the Educational Service Unit Number 6 districts, also participating in Rural Nebraska on the Move, which is a $1.2 million federal grant through U.S. Department of Education. The grant is part of the Carol White PEP, or Physical Education Program grants through the Department of Education. In this role as project director, Jane has been a roving employee providing professional advice and grant-related oversight to all participating schools. Jane has been instrumental in assisting 6 districts adopt a more comprehensive approach to promoting student health and physical activity while integrating staff wellness programming. Through Jane's leadership, thousands more Southeast Nebraska public school students are learning the value of fitness testing in planning personal wellness goals and participation in staff wellness programming in member districts. It has increased substantially. The focus of the grant has been to encourage increased healthful food consumption and promote physical activity. Jane has managed to achieve this while maintaining an excellent leadership impact as the chair of the Norris Schools Coordinated School Health Council. As chair of the council, Jane has overseen an annual review of the district health and wellness policy. She's helped to institute a food service advisory board, including students and parents, to provide input into menu planning, and sponsored also an annual health fair connecting community partners with the school in the health and wellness area. Jane truly represents the values and the mindset required to be a leadership champion for wellness. Her impact continues to grow in promoting healthy lifestyles for all of those touched by her work. And for all of this, please step forward, Jane Hansmeyer, for the Wellness Champion Leadership Award. Now I would like to recognize 2 individuals for being breakthrough leaders. This is a professional award that recognizes a new and/or advancing leader in the field of wellness and health promotion. A person who earns this award is one who has demonstrated strong leadership ability. They have passion for wellness, have an undying quest for knowledge. They're humble, they're innovative, and they share what they have learned with others while supporting the wellness mission in our communities. Our first recipient is Greg Howe of Lincoln Industries. Greg began there in 2008 as a wellness intern and was quickly selected full-time in 2008 as a wellness specialist. In a short time, he showed his commitment to the well-being of those at Lincoln Industries and in the community, and was promoted to wellness manager in 2011 to current. Greg has been instrumental in evolving the wellness culture there and in the community over the past several years. In his role at Lincoln Industries, Greg helped get the first on-site health clinic in Nebraska launched and continues to develop new services to offer their people and their dependents age 6 and older. He has also helped create and maintain Lincoln Industries on-site fitness center. Also Healthy U Fit, I guess that's what it's called, right? Healthy U Fit. That is free of charge for their people and their significant others. Greg continues to identify different ways to inspire people to enhance their well-being through smoking cessation programs, also life planning classes, fuel for performance, and leadership development courses that always have one parameter related to wellness outcomes. He continues to volunteer in the community with the Partnership for a Healthy Lincoln, where he is leading the charge, really, to change the health and well-being for those in Lincoln and the surrounding area. He has also been involved in other various volunteer opportunities. Greg models the way of wellness for others by participating in runs and walks and wellness activities in the community and surrounding areas, and encourages others to participate by training and participating side by side with those first embarking on their wellness journey. Greg is an active member of HERO, Health Enrichment Research Organization, which is a national leader in the creation of employee health management research, education, policy, strategy, leadership, and infrastructure. For the way Greg has been able to break through and reach out to so many in our community and even nationally, I ask him to step forward so he can receive the Breakthrough Leader Award. Our second Breakthrough Leader recipient is Andy Link, Wellness Coordinator of Lincoln Electric System. Andy was nominated by someone outside his organization, Dr. Robert Rhodes, who took notice of how Andy has made great strides for the wellness of LES employees. Dr. Rhodes said, quote, "It is my pleasure to nominate Andy Link from LES. He is the consummate example of a leader for wellness in the workplace. He has introduced wellness opportunities to the staff and families of LES. He has organized guest speaker talks, progressive wellness screenings, and ideas for improvement and encouragement, or how he lets the staff know that he cares, just like the community tagline for LES's community donation opportunity that says, Lincoln Cares. Other ideas that he believes in have made him a community leader for his employees. He lives by example as he really strives to balance mind, body, and spirit. Other Lincoln companies, large and small, could learn by his ideas and innovation," unquote. Andy has taken the time to thoughtfully plan and has worked hand in hand with WorkWell to establish and strategize the best practices to positively impact the health of LES employees and family members. His wellness program has already received high marks by recognition for LES, with the Governor's Wellness Award proving that employees have become healthier, and most remarkably, by having decreased healthcare claims by 17% over the 3 years prior to receiving the 2013 award. But Andy, he has not stopped just because the organization has won the Governor's Wellness Award. He knows that more can be done. And he has gone about the business of sustaining an already thriving program to make it the best. For all of this, and for what Andy continues to do, I ask him to step up and receive the Breakthrough Leader Award. Come on up, Andy. Our next award category is a professional award called the Leading by Example Award, and this one recognizes an individual who leads by example through exemplary leadership skills, wellness passion, and humility. They walk the talk and demonstrate their support of wellness through their personal and professional efforts. Dave Milnerick, Executive Director for the Nebraska Sports Council, is this evening's recipient of the Leading by Example Award. Dave has been an active board member for WorkWell and a proponent of worksite wellness with the Live Well Challenge series, giving teams of employees across Nebraska a fun way to compete and stay active throughout the year. His collaboration with WorkWell in providing a trusted and affordable resource for worksite wellness promotion has been exemplary. Also under Dave's leadership, the Nebraska Sports Council has established many physical activity events that participants have come to look forward to annually, including the Mud Run, the Pumpkin Run, and the Cornhusker State Games. Dave has put Lincoln and Nebraska on the map by working tirelessly to bring this year's State Games of America here this summer. What a great leader for our state. We don't want to forget to recognize Dave's own personal healthy lifestyle. Dave is a true competitor and has competed in such events as the Cornhusker State Games Triathlon. He's an avid runner. He enjoys social wellness through activity with his band called Spare Change and practices spiritual wellness, recognizing the importance this is to his basically overall well-being. For all you do for wellness for our state and community, please come forward and receive the Leading by Example Award, Dave. It is now my privilege to tell you about our Lifetime Wellness Ambassador recipient. This award recognizes individual leadership in culture and policy change within Nebraska's work sites over a long period of time. And the first ever Lifetime Wellness Ambassador Award is going to go to Barbara Pearson. Barbara recently retired from the State of Nebraska Department of Health and Human Services, and she is solely responsible and the first person to have a vision of worksite health as a public health strategy in the United States. Following the example of Bill Kaiser and his initiatives in Omaha, Barbara started the public health side of the movement in Nebraska with WorkWell and the Lancaster County Health Department. Barbara agreed to have wellness as part of the cardiovascular health block grant. She supported this initiative for nearly 30 years. She has also supported growth of the Panhandle Wellness Council and fostered support of other wellness councils through her leadership at DHHS. Other states that now have councils as outgrowth of Barbara's vision include Montana, Michigan, West Virginia, Indiana, Maine, and Massachusetts. Her insight and support has made it possible for WorkWell to thrive in our region and state. Barbara was also instrumental in supporting the development of the Governor's Wellness Award, which launched in 2008. This award has become the structure of other state awards, including West Virginia, and has become a desired recognition process by many of our Nebraska businesses. Today, the CDC looks to Nebraska as a model for the rest of the country. Isn't that great? The National Healthy Worksite Program was born out of the success experienced here in Nebraska. Nebraska outcomes include decreased obesity, increased physical activity, decreased depression, decreased tobacco use, and much more. Barbara is probably the most deserving of a Lifetime Ambassador Award of anyone in the country. Congratulations, Barbara Pearson, on your well-deserved recognition. Come on up.
It's so good to be here with so many people who are my friends, my favorite people, and people whose work I admire and respect. Thank you for this profound honor. Here's my awkward parody of words of Lou Gehrig. Tonight I feel like the luckiest woman in the state of Nebraska. I'm lucky to have the opportunity to work toward the improvement of lives of others. My 40 years in public health service has made me grateful for a bunch of things. They are being born in the United States and growing up in an era when the economy was booming for the middle class, and having parents who were employed, married to each other, and created a stable home for me and my 4 brothers. The availability of free public schools where I learned to read and express myself in the dominant language of the country. That's a reference to Lincoln literacy. Having parents who taught me by example the value of hard work and who supported learning and respected school as a means of improvement. Having grandparents who taught me the value of the natural world and the real source of the food we eat. My grandpa was a butcher, a farmer. Attending a public high school where I had teachers like Mr. Emmerich who stoked my interest in science and medicine and helped me to get ready for college and for teaching science. I landed a job at the state during a time when nationwide population-based cardiovascular disease prevention and block grants were being launched. I'm grateful for having terrific supervisors who allowed me to learn how to be a health educator first, Jim Dills, and a health health program manager, those people right there. Having a spouse who accepted my sometimes long work hours and shared child rearing and household duties equally as any marriage I've ever seen. That's a big one. Having competent and resourceful coworkers, like one of those, who taught me about their visions of public health and making the lives of Nebraskans healthier and safer. The existence of visionaries here in Nebraska who began developing worksite wellness, like the industries that are represented here tonight, and the whole movement that became WellCoa and WellCom. I'm grateful for having been encouraged to develop a new relationship with agencies, between the State Health Department and other agencies, and to use financial resources in creative ways in order to implement relatively untested strategies to protect and improve the health status of adults. And WorkWell grew out of that. I'm grateful for the advancement of public health field, strengthening how need is documented and progress is documented in order to protect the funding. That's important. If we didn't do some of the record keeping, we might not have the funding to continue to do the record keeping. And being able to retire confident that the Preventive Block Grant, the source of the funding, is in good hands, and that worksite wellness is going to continue to make a difference in people's lives. One of my favorite sayings has been printed on millions of posters. Margaret Mead said, "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, that's the only thing that ever has." And if you don't think public health and the people at industry are a small group of people, just do a head count of people who are not in that industry, and you'll see that it is truly a small group of people. Thanks very much. I'm proud of myself, and I'm proud of you all, too.
I get the pleasure of closing the evening down, but again, I just want to say thank you, everybody, for making this first ever event very successful and very rewarding for our staff. When we get to see these stories come in and we get to celebrate people's successes, that is clearly the best part of our job, clearly, other than working with all of you and also supporting people. Unfortunately, last night I had the strangest dream. I dreamt that I fainted in the middle of my ending speech, so let's hope that doesn't happen. I don't normally have weird dreams like that, but I did last night. But I would end with something that I feel is, I actually prepared something, but I'll end with the theme of the evening, which really is that we are all in this because we are very purposeful in what we do. We live by purpose. We set the example, right? And we're passionate about what we do. We don't do this because there's financial rewards in it. That's the bonus. The real reality is that we do this because we care about people, we're passionate, and we do that because we are purposeful human beings. So I congratulate all of our winners, and I thank you all for a very successful night, and we will look forward to seeing you next year. Thank you so much. Have a wonderful evening, and be safe.